Ji, Assalamu alaikum. Today's presentation is about the instruments in pediatrics. This is endotracheal tube. So, what are its three uses? Uh, we used to give ventilation through it. Uh, we used to do tracheal suction through it, and we used to give medication through it. This is a laryngoscope and different sizes of blades. And clinical uses are for visualization of upper airway, and another clinical use is for uh, endotracheal intubation and suction. This is otoscope, and this is the earpiece. These are different sizes of earpiece. And what are its uses? It is used for the visualization of eardrum and external auditory canal, but abnormal findings can be seen. So we can see some wax, blood, ear discharge, or perforation of the eardrum, and any foreign body or Grommes tube. This is Neonatal Incubator. Four advantages of using this equipment, like for thermoregulation, for humidification, for isolation or prevention of infection, barrier nursing, minimal handling. These are all benefits, and we can visualize the baby during all this management in the incubator. This is the mid upper arm circumference tape, measuring tape, and indication is for check the nutritional status of the baby or to assess the malnutrition. What will be the expected value in a normal child 1 to 5 years of age? So the circumference would be 13.5 to 15.5 centimeter in a normal child, but in case of severely malnourished child, the mid upper arm circumference would be below 11.5 centimeter. If it is below 11.5 centimeter, then it would be severe malnutrition. This is peak flow meter. Indications: it is used for the peak expiratory flow rate, and in which medical conditions the instrument is helpful. It is used in um, asthma assessment, in cystic fibrosis, in bronchiectasis. This is the side through which the patient blow, and this is the meter. Uh, this is a meter dose inhaler, and this is the spacer used for medication, inhalation medication. Uses are inhalation medication. What three drugs like beta 2 agonists like salbutamol, anticholinergics like ipratropium, and inhalation steroids we can give through this spacer. This is the instrument called Stereometer, and it can be used after 2 years of age. What is normal height at 2 years and 4 years of age? Somebody asked. So 2 years, 85 centimeter, and 4 years 100 centimeter respectively. This is the Infantometer. Maximum age for use up to 2 years maximum we can use it. So under 2 years of age we can use for the Infantometer. What is the optimum length for newborn? Of newborn, optimum length is 50 centimeter, around 50 centimeter, and 1 year old child 75 centimeter. This is phototherapy unit, and what are indication used for neonatal jaundice, especially if it is due to unconjugated hyperbilirubinemia. Three possible complications can be hypothermia, skin rash, and dehydration, and any damage to the eyes or gonads. So we cover eyes and gonads while on phototherapy, and gastroenteritis. This is the pulse oximeter showing saturation 96%, heart rate 58. So instrument pulse oximeter, two parameters I have told you what are expected normal value in 1 year old infant. So normal value around 90 to 95%, should be saturation in 1 year of age. Heart rate should be around above 120 beats per minute. 120 to the range should be 120 to 160 beats per minute. This is the ambo bag. This is the razor wire. This is the baby face mask, and this is the oxygen pipe, and its uses are for the manual ventilation of newborn for or infants for hypoxia or apnea. What should be the desired rate in a newborn baby? It should be around 40 breaths per minute. So what is this nasogastric tube shown? And the child baby is very happy. Only few babies would be very happy, but most of them will be annoyed on the nasogastric tube. So give 3 indications of this procedure for gastric lavage, for secondly for nasogastric feeding, and third you can say for gastric decompression. Thank you very much, and if you have any question you can ask in the Facebook comment section. Thanks.